Many many questions are asked regarding side effects or toxicities of penicillin, tetracycline, clindamycin, etc. What are symptoms seen during allergic reactions to penicillin? Dermatitis, stomatitis, bronchoconstriction, and cardiovascular collapse. What agent produces GI upset and pseudomonas colitis? Clindamycin. Which agents are most likely or least likely to cause superinfection? The most likely to cause superinfection are agents with broad spectrum, such as tetracyclines. Tetracyclines, remember that they bind to 30S subunit of the ribosomal subunit, decreasing, inhibiting the production of proteins for use of the bacteria. This means that the bacteria will not have proteins available because there is no production of there is the production of the production of the bacteria is, the production of proteins is impaired. It's a bacteriostatic. And tetracyclines are also a broad spectrum agent, and they can cause superinfection. The least likely to cause superinfection is a narrow spectrum agents such as penicillin G. Remember that penicillin G is not very much used on dentistry, and it should be used not orally, because penicillin G is degraded very easily in the GI tract because of the acidity. So it has very little use on dentistry. Now, aplastic anemia is associated with chloramphenicol. Remember, aplastic anemia, chloramphenicol. Liver damage or hepatotoxicity is associated with tetracycline. Liver damage or hepatotoxicity is associated with tetracycline. Liver damage or hepatotoxicity is associated with tetracycline. Erythromycin estolate associated with allergic cholestatic seeing allergic cholestatic hepatitis. Again, erythromycin estolate is associated with allergic cholestatic hepatitis. Let's read that again. Many questions are asked regarding side effects or toxicities of penicillin, tetracycline, clindamycin, etc. What are symptoms seen during allergic reactions to penicillins? Dermatitis, stomatitis, bronchoconstriction, and cardiovascular collapse. What agent produces GA upset and pseudomonas colitis? Clindamycin. Which agents are most likely or least likely to cause superinfection? The most likely are broad spectrum agents such as tetracyclines, and the least likely are narrow spectrum agents such as penicillin G. Remember that penicillin G is also degraded by the acid on the stomach, so it's not used orally. It can be used intravenously. Aplastic anemia is associated with chloramphenicol. Liver damage or hepatotoxicity is associated with tetracyclines. And erythromycin estolate is associated with allergic cholestatic hepatitis. Next, questions involving interactions between antibiotics and other drugs. For example, tetracycline and penicillin cancel each other out due to opposing mechanism of action. So they have different opposing mechanisms of action, tetracyclines and uh, penicillins. So penicillin and tetracycline contrast each other. They cancel each other because they have opposing mechanisms of action. Uric acid reducer. Oh, sorry. Next is probenecid. Alters the rate of renal clearance of penicillin. Probenecid is a uric acid reducer. And reduces the renal excretion. Again, probenecid alters the rate of renal clearance of penicillin. We're gonna look for probenecid. And we're gonna look at that in our, let's see, probenecid. Probenecid it's co-administered with antibiotics to delay renal clearance of the antibiotic, to elevate and prolong the antibiotic's serum concentrations when high tissue concentrations are necessary. In some cases, probenecid administration can more than double the drug's serum concentration. The drug's half-life would be prolonged, given concurrently with natural penicillins to increase their blood levels. Most penicillins are handled by the kidneys as organic acids and excreted by renal tubular secretion. Probenecid interferes with tubular handling of organic acids inside the nephron. Probenecid affects most cephalosporins, natural penicillins, and other beta-lactam-related antibiotics like aztreonam and imipenem. Again, most penicillins are handled by the kidneys as organic acids and excreted by renal tubular secretion. Probenecid interferes with tubular handling of organic acids inside the nephron. Probenecid affects most cephalosporins, natural penicillins, and other beta-lactam-related antibiotics. Probenecid inhibits renal tubular cell secretion that raises penicillin blood levels by diminishing their tubular secretion. Probenecid is sometimes given simultaneously with penicillin to raise penicillin blood levels for increased activity and is the drug of choice to treat gout. Nafcillin, oxacillin, cloxacillin, and decloxacillin are lipophilic and are excreted by biliary means, the liver. Thus, a combination of probenecid or dosage adjustment for renal dysfunction is not necessary for these penicillins because they are not secreted renally, rather in the liver, biliary means. By biliary means is nafcillin, oxacillin, cloxacillin, and decloxacillin. So that was about probenecid. Now, probenecid is an inhibitor. Okay, again, most penicillins are directly excreted into urine via renal tubular cell secretion. Probenecid, an inhibitor of renal tubular cell secretion that raises the blood levels of the penicillins by diminishing their tubular secretion. Probenecid is sometimes given simultaneously with penicillin to raise the blood levels for increased activity and is the drug of choice to treat gout. Okay, so probenecid. Do we have any questions about that? In the file, don't close, we're gonna see probenecid here. Probenecid. And We don't have anything. Well, we do. We just have one in drug interaction. It says the file is don't close SUFF, and the drug interaction is penicillin and probenecid. It increases toxicity of MTH. Probenecid, let's see another one. Probenecid is used in a drug in which condition? Gout. Another question. Aspirin plus probenecid, what will happen? I would think that it will also increase the duration of, I don't know, probably increase the time that aspirin is in the body. I don't know. Question says a non-steroidal anti-inflammatory agent that appears to produce fewer gastrointestinal disturbances than high doses of aspirin is. Probenecid comes as an option, which obviously is not. It's not also acetaminophen, because acetaminophen is Tylenol, and Tylenol is not a non-steroidal anti-inflammatory agent, so it should be ibuprofen. And